Welcome. This is the Medicaid Home Care Application Process class from Caring Kind. Today is March 27th, 2020. Hello, my name is Douglas Chu. I'm an elder law attorney, and I regularly give these educational talks for Caring Kind. Due to the current medical emergency, Caring Kind has asked me to record these talks so that you may attend these classes from the safety of your own home. Today's talk will last for about 1 hour, and I will be referring to the materials that have been provided to you by Caring Kind, which I will go over in a second. This class is really part 2, or a second class, that is supposed to be attended after you've attended part 1. And part 1, I've also done a tape for, which is dealing with legal and financial planning for Alzheimer's patients and their families. And in that class, we cover powers of attorney, healthcare proxies, living wills, and we conclude with a basic review of basic Medicaid eligibility rules and invite you to attend this class on how to do a Medicaid application itself. You don't be too upset if you haven't attended part 1. There's enough material here that you'll understand, but you can go back and forth between the 2 tapes. So you should have a packet provided by Caring Kind, either by email or in mail. And in that packet, you have a lot of great stuff. Everything I'm going to talk about today is in writing in that packet, okay? And everything I discussed today is in that packet. However, I'm not going to be wasting your time with just reviewing the documents in there. You're all very intelligent people, and you can read the materials on your own later tonight in bed. But since you have a real, live elder law attorney who practices and does Medicaid, and I've been doing Medicaid applications for like 30 years now, that I'm going to be basically focusing on useful tips and helpful hints that could trip you up in the application process, and also make you familiar enough so that you can make it through, or as I tell people, either in this class you'll decide, oh, that's not so bad, I can roll up my sleeves and do the application myself, or, oh my God, this is too complicated. I'm going to go and hire somebody to do this for me. And there are plenty of people out there who you can hire to do this. There are private geriatric care managers, there are social workers, there's people like myself, an elder law attorney. Elder law attorneys do applications all the time. And also you can also call into Caring Kind's helpline to get some tips on, if you have any problems. So let's get started. So today's game plan is to, number 1, review Medicaid eligibility rules briefly, because I have no idea whether you actually attended the part 1 class like you're supposed to, or maybe you attended the class with a different lawyer teaching it, because different lawyers do teach that class. And I'm not sure how much they've taught you or how much you've understood. So we are going to do a quick review with my PowerPoint slideshow of the Medicaid eligibility rules, because you shouldn't even be attempting to fill in and complete a Medicaid application unless you are Medicaid eligible. It's just a waste of your time. They'll reject your application. You'll have to do it all over again. So it's important to understand the basic elements of Medicaid eligibility before you even start to fill in the application. And then after we cover for about 15, 20 minutes the Medicaid eligibility rules, then we will go through an actual Medicaid application, and you will find all these in your packet. You should find my slideshow. It has my name on the front, Douglas Chu, and my PowerPoint. And then you will also see in your packet an actual Medicaid application called Access New York. And there's 2 parts to that. There's also Access New York Supplement A. So those 2 forms you should also have available to you, in front of you, because we will go almost line by line just to show you what an application looks like and what have questions and how to answer them. Okay? So let's start with basic Medicaid eligibility. So if you pull out your PowerPoint slideshow, and it's up here on the screen, I think I figured out how to do this. And what will happen is we'll just flip through the slides quickly and so you have an understanding of how Medicaid works. So Medicaid is different than Medicare, right? Most people 65 and older have Medicare. Medicare covers hospital, doctors, some rehab. Medicare has nothing to do with money. Okay, Donald Trump has Medicare. Medicaid, though, is sort of like the safety net to pick up the things that are not covered by Medicare. Medicaid covers long-term care. After you come out of the hospital, after you've had your hip replacement, after you're recovering, so on and so forth. It covers the things that are not covered by Medicare. And also differently than Medicare, Medicaid has to do with how much money you have. They look at your income and assets. So it's important to understand this thing. So let's go through the slides. So the first slide shows that Medicaid services that we're covering today only, the Medicaid service program we're talking about only covered New York state rules, okay? There are 50 different states. There are 50 different Medicaid programs, okay? Each state will vary, okay? There's a lot of similarities, but they're different. You go across the bridge to New Jersey, and New York, Medicaid rules here in New York are so different, okay? It's really very different. So just important that if you have a loved one in another state, okay, you really need to consult an attorney or some specialist in that state to understand the local Medicaid rules. Because what happens is there's a federal Medicaid program, there's this cost sharing between New York State and state and the federal level, and the more services they offer, the more money the state has to put in. So you'll see that's the cause of the variety. Now, as you see on this slide, there's basically two types of services that one can get for Medicaid. There's home care Medicaid, and then there's nursing home Medicaid. Today's class only deals with home care Medicaid. We will not be getting into any depth in nursing home Medicaid. Of course, we will briefly touch on it because you can't help it. But if you find yourself confronted with the need for nursing home Medicaid, it's probably advisable to sit down with a Medicaid specialist, Medicaid attorney, because there are things that you can do to preserve assets and deal with a more complicated application. Now, as it says in the top box, the most important thing you need to understand is that you can only apply for Medicaid when you currently need Medicaid services, okay? This is not Medicare. Medicare, you can walk around with the Medicare card in your pocketbook or your pocket wallet and have it ready to go whenever you may need it, anytime, anywhere. You could be healthy for 20 years and then pull out your card and use it. Medicaid is only available when you need services right then and there. Okay, so when you apply, they're going to assess, they're going to see if you need services. Yes, if you don't need services, they're going to turn you down, or even if you somehow get accepted, if you don't use the card for services in a few months, they're going to shut down your case. Okay. The second thing to notice at the bottom box of the slides is that you cannot apply for Medicaid if you need very short-term services. Basically, the rule is you're going to need to have services that require continuous care for at least 120 days. Meaning that, you know, if mom or dad just breaks their foot and is hobbling around the apartment and you might need some care, you say, well, let's try to get some Medicaid in here. When they come and assess mom, they're going to go, well, the cast is going to come off in a couple of weeks and you'll be walking around. So that, you know, you don't need at least 120 days of continuous services. So that's just a criteria that a lot of people overlook, and they think they want to apply for Medicaid just to have it ready to go. That doesn't work that way. All right, next slide, slide 3. All right, I mentioned at the beginning it's a means test of government entitlement. Basically, they're going to look at the person who's applying their income and their assets in the bank or whatever else they may have. And they will, of course, do a medical assessment of how many hours. So as you see here on the chart, there's a Medicaid applicant, and they're going to look at their monthly income, okay, on the left side. And if the income is too high, they push them into what's called the surplus income program, which we'll talk about on the next page. Then they look at the center box, the resources, how much money you really have. And if you've got too much, we're going to talk about, is there some way to dispose of that money and move that money out of your name to make yourself poor enough to be on Medicaid? Then on the far right, there is the basic Medicaid review of, how many hours of care you need and so on and so forth. And I make a comment in the last box at the bottom of the page that you really should only be applying for Medicaid if you need more than just housekeeping services. It's not worth it just to have light housekeeping, which you can get under Medicaid. But if you have money, it's probably better just to private pay for to do a little housekeeping than to try to get Medicaid. It's a very complicated program to apply for. Okay, next page. Surplus income program. So when you apply to Medicaid, they look at your monthly total income, and they total it all up, and they say, well, you're only allowed to have $875 a month, or only allowed to keep $875 a month to be on Medicaid. All right, and that $875 is supposed to cover all your living expenses: food, clothing, shelter, rent, utilities, cable TV, electric bill, water bill, groceries, everything, which is impossible. Okay. Excuse me. Now, in the home care, which is on the left side of the page, when you're applying for home care, if you just mailed in your own application and show them all your income, Medicaid would say, okay, you get to keep $875 to pay for all your expenses, and then you have to give us all the surplus. So if you have an income of $1,875, $1,875, you have to give Medicaid $1,000 a month surplus. Look at deductible, look at your copay every month, okay? And then you're only left with $875, which is impossible to live on in any city, not only just New York. So what do people do? What people do is the center box. People use what's called a pooled trust, or it's also known as a pooled income trust. Okay. Basically, you open up the pooled trust, and in your packet that was sent to you is a list of pooled trust organizations. They're run by charities, not-for-profits. You can read about them. There's a 2 or 3 page handout in your portfolio that lists a number of trusts and how much they charge and how they work. Okay, so you can read about that later. But you open one of these trusts, and then what happens is any money you put in that trust, okay, becomes invisible to Medicaid. So in my example of $1,875, you would put your $1,000 surplus in the pool trust, deposit it in there. It's like a bank account. And you put the money in there, and any money you put in there becomes invisible to Medicaid. They just say you don't have it. And you get, and Medicaid says you keep the $875, as long as you show us you put the $1,000 or whatever it is in the pool trust, you're eligible for Medicaid. So the question then you must ask is, what happens to the money in the pool trust? The pool trust money still belongs to the applicant. It's their money to spend on whatever they'd like. But however, it is not an ATM machine. You cannot take cash out of it every month. You can only send bills there, and they will pay them. So you send your rent bill there, you send your Con Edison bill, you send your Verizon telephone bill, and they will pay the bill for you. Okay. I think there is a little description of trust in your packet too. But basically, the only other thing that people get concerned about is that any money left in the trust upon your death is a donation to the charity that runs the trust, but that shouldn't be a big problem because usually you spend all the money every month, so there's very little left when you pass away. The money in the trust can only be spent on the applicant, okay? Can't be spent on family members or whatever. But it can easily be spent on anything: plane tickets, bus tickets, you need new furniture for the house, whatever. So it's a good deal, basically, to be able to keep your money. If you go across the bridge in New Jersey, you can't do this. You have to give all your surplus money above the Medicaid level to the Medicaid program. No other choices, okay? Finally, on this chart, we show nursing homes. And nursing home, if you have to move into a nursing home, God forbid, you cannot use a pool trust. Basically, you hand all your monthly income. Okay, monthly income is all sorts: Social Security, pension, RMD distributions from your IRAs, annuity payments, anything like that. You must hand all your income over to the nursing home that you're residing in, and then you would apply to Medicaid, and Medicaid would say, fine, you give all your income to the nursing home, and we will pay the rest of the bill. right? Because if you don't know, nursing homes cost at least $18,000 a month. Okay, so just by contributing your fixed income to nursing home, Medicaid will pay the rest of the bill. While you're residing in the nursing home, you are allowed to keep, they give you back $50 for candy money, have your hair cut, whatever, okay? So income is not a problem. People should not be afraid of going on Medicaid because it's often, I hear people say, well, I can't live on $875, I can't afford that, to do that. Well, you don't have to. Full trust solves that. I have many people who have, $4,000, $5,000, $6,000 a month income on Medicaid, and they're putting the extra money in a pool trust. Okay. Okay. Next slide. Now we move on to assets. Excuse me. So resources, as a result of income, and you have to separate this. Income is a monthly check coming in every month. Okay. Resources is money just sitting there, or some kind of asset sitting somewhere that you can liquidate and spend on care, right? Now, under the Medicaid rules, you're only allowed to keep in your name, when you apply, $15,750, okay? Now, when you're getting to that number, there are certain assets that are exempt, okay, that you don't count when you're tallying up to see if you hit the 15,750. And they're all listed here on this chart, okay, starting from the left side. Personal items, you're allowed to keep all your furniture, you can keep all your jewelry, you're allowed to have a car, you're allowed to have a prepaid funeral. You're also allowed to prepay the funerals of your entire family if you wish. The next box is very interesting for most people, retirement accounts. If you have IRAs, 401ks, or any kind of deferred compensation. Basically, all that money in those accounts is exempt, okay? However, for it to be exempt, you must be taking withdrawals from the account, basically, if you have an IRA, most of my clients are seniors, so if you're over 72 years old, you must be taking your RMD, required minimum distribution, okay? So as long as you're in RMD payout monthly, Medicaid says your money in the IRA itself is exempt. So you can have like $1 million. Well, after the crash of the stock market, you don't have $1 million anymore. But if you had $1 million in your IRA, that's exempt. They won't count that. But you are required to be taking the monthly income distribution from that IRA. And that, of course, adds to your monthly income, previous slide. And then you are on, what do you call it, the pool trust. Goes into the pool trust as income, right? The next box is homestead. The homestead, the house, the co-op, the condo that you live in is exempt, okay? As long as you're alive and living in it, or if your spouse is alive and living in it. Now, there is a maximum home value at the bottom of the page. If the house, co-op, condo is worth more than $893,000, that will eliminate you from being eligible for Medicaid, okay? Then that's the equity value, okay? And they're not too firm on it. I mean, it's not, we're not talking about market value. We're talking about assessed value for tax purposes. So, that can be fudged a little bit. Now, you do have to worry that it's in red. I've written there that while it's exempt while you're alive, that if you pass away owning a house or a co-op or condo, and it has to pass through your will into your estate to your family, Medicaid will show up first in line. They are a primary creditor, just like any debt, and they will show up at the probate of the will. So if you are concerned about protecting your homestead from Medicaid recovery, I strongly advise you do sit down with an elder law attorney and talk to them about the possibility. There are certain possibilities and options to try to protect the house and prevent Medicaid recovery, all right? That's too deep for today's class, but just know that if you're worried about that it is a worry to have, and that you should go sit down with an elder law attorney who specializes in Medicaid so that they can explain to you what options there are about protecting your house. The final box deals with restitution payments. We don't see much of this anymore. If you're a Holocaust survivor getting restitution from Germany or Austria, that money is exempt. Okay, so most people have more than $15,750 in their name. So what do you do? Okay, next slide. All right. This is my famous slide. I've been using this slide for 30 years. Okay, explain the process. So what happens if you give money away? Okay, I just explained to you if you have more than $15,000, you're not eligible for Medicaid. What if that man the wheelbarrow has more than $15,000? And what if he just moves it to friends or family to hold for him? Okay, well, in New York State, if you see here on the left, there is no penalty. There's no wait. There's no restriction. So if you give all your money away, the following month you apply for Medicaid home care services, and you will get them because we do not have a transfer penalty for home care, right? Now, many of you, if you've done any kind of research, heard anything about Medicaid, will be saying, as if we were in the class, you'd all be saying right now to me, well, what about, I heard there's a 5-year wait or 5-year look back, okay? Well, there is, but it only applies to nursing home care, okay? So if you could promise me that the person was never going to a nursing home, and you cannot promise me that, then I'd say just move all the money and get the home care and you'll be fine, okay? But nursing home, unfortunately, can crop up later on when things get bad. And therefore, if the person does need nursing home care within 5 years after giving the money away, then that money may have to be returned to help pay for the nursing home. So if, and gifting should be done under the advice of an eligible attorney, just like saying, taking drugs should be done under the supervision of a doctor, that, if it's gifted away, the person receiving it should be under the clear understanding that that money may have to be returned if the ill person needs nursing home in 5 years. Now, if 5 years passes, 5 years of one day goes by, that money is fully protected, and that person will walk right into a nursing home. So therefore, one of the golden rules of elder law planning is the earlier one can divest their money away to friends or family or into a trust or whatever, 5 years before you need nursing home care, all that money is protected. Okay, there's as long as you can do it more than 5 years. And of course, who can predict how long, 5 years is a long time. So it's a little hard to anticipate, but it can be done. So now, some of you out there may be dealing with a husband and wife situation, okay? And, of course, if there's no spouse, then all the money would, can be moved to a child or a friend or to a trust. But if there's a spouse, you have a husband and wife, and one of the couple is ill, then the most common thing to do is to move the money to the spouse from husband to wife or wife to husband. Okay, we're on slide 7 now. Now, what you should know is that giving money over to a spouse in New York State causes no transfer penalty for home care, as we explained on the previous slide, but also it causes no penalty for nursing home care either. So if either a husband or a wife needs home care or nursing home care, just by moving all the assets over to the other, one can get full nursing home coverage, okay? But there's no free lunch, okay? So as we go down my chart here, so transfers between husband and wife cause no penalty for anything. But we must do this thing that now the spouse who has all the money now is married to that other person. And if you know basic family law, husbands and wives are legally responsible to pay for each other's debts and medical bills. So in New York State, we have a unique thing called spousal refusal, okay? And in your materials is a 2-page handout that discusses a little bit about spousal empowerment budgeting. And is also in your packet the actual spousal refusal form that you would use, that you would attach to a Medicaid application if you were a spouse married to someone going on Medicaid. So what happens is you move all the money to one spouse. The spouse who has all the money then signs this letter, this form that says, I have money, I need this money to live on the rest of my life. I refuse to pay for the health care of my ill spouse, okay? And then Medicaid says, okay, fine, we cannot count the money that's in the refusing spouse's name, and they must give the poor spouse Medicaid. all right? There are allowances, as listed here, for the ill spouse, the well spouse, that they're allowed to keep a certain amount of income and resources, and that's also explained in your handouts. So what happens is you move all the money to your spouse, they do the spousal refusal, and then you get Medicaid, home care, or nursing home, all right? However, as you see at the bottom of the page, Medicaid will then, of course, not of course, but you should be told this, that they will investigate the spouse who has all the money and decide, how much money really is there, and can they or should they afford to pay the government back for reimburse reimburse the state Medicaid program for having taken care of your spouse. And this should be discussed with your attorney. It is the right thing to do because it does save the couple a lot of money. Okay, it's not free. You don't get off scot-free. You still have a debt to pay to Medicaid, but I can't explain it today, but you will save a lot of money by seeing an attorney and doing spousal refusal, and even if Medicaid pursues you, in the end, you save a lot of money. Okay. All right. Next slide. So let's just talk about how Medicaid mechanically works. So we just covered the basic income and resource regulations. You know what the rules are. Those numbers should all, your income numbers and your pool trust and your asset levels should all be correct. And then we're going to talk about the actual application in a minute. But I think it's important for you to know how the structure of Medicaid works and why it's working, so that when letters come in the mail and you're dealing with all these different departments, you know what's going on. So basically now we call Medicaid MLTC Medicaid. Okay, it's basically Medicaid has become like an HMO. Okay, we call it managed Medicaid. Basically, when I do an application for a client, we apply, we get them a card and a number, Medicaid number, and then they take that card and number and they shop around and choose their own MLTC home care agency. Okay, and in your packet is a list of the MLTC agencies available in New York City. Okay, also there is a 4 or 5 page handout that explains the difference between the different kinds of MLTCs. It's like 2 or 3 types of MLTCs. But basically, for your perspective, you just have to know this, just like a home care agency. You will take your card and your number, you'll choose an MLTC home care agency, you'll show them your card and your number, and then they come and assess and give you hours. And then what happens is Medicaid pays that MLTC a fixed dollar amount per month to take care of your loved one. Okay, and just for your information, it's like about $4,200 plus or minus a month they get paid, regardless of how many hours you're given. Whether you're given 4 hours a day, 7 days a week, or 24 hours, 7 days a week, the MLTC gets paid, the $4,200. So you can kind of put 2 and 2 together that they, of course, they would prefer low-hour cases, but of course there are some protections we'll explain in a minute that kind of forces them to make sure they don't just cherry pick and choose low-hour cases. Okay. And then once you're enrolled in the MLTC, they're supposed to be monitoring you, making sure you're well cared for, bring in all sorts of care that you might need, PT, OT, physical therapy, you can go into daycare centers, and so on. All right, so they're your point of entry. And basically, Medicaid has subcontracted out all care to agencies. There's no such thing as a Medicaid provided home care person anymore. I mean, there's a little department like that, but it's not even worth going into today about that. Okay. So how long will the application process really take? So I tell clients it's going to take 2 to 3 months from the date we actually hand the application in. Okay, and that's assuming we have everything, because sometimes people come to see me and it drags on. We're into like the 3rd or 4th or 5th month trying this application, and they go, "You told me it was going to be 2 to 3 months." And then I remind them. I said that when I have everything that's ready, and I can't help it that you tell me that you don't have a Social Security card, you have to reorder a Social Security card. That you've lost the divorce decree from mom and dad, you have to go order it from the court, or the birth certificate's missing, so we have to go to, or your Medicaid card's missing. So all these things take time to prepare for the application, but once we have the application and you hand it into Medicaid, we're seeing, at least prior to this coronavirus disaster, about a 30-day turnaround for the application to be approved. And then you get a card and a number. And then by the time you make an appointment with the MLTC agency and have them come to the house to assess and put care in place, another month after that. So that's why 2 to 3 months, depending on how everything falls. Okay. All right, next slide. This is just a typical timeline with maximum time frames for things. So someone who threw an application on January 1st, if Medicaid dragged their feet and did the maximum amount of time they're allowed to process certain things, and MLTC is allowed to process certain things in conflict-free, you may not get care until April. All right, so that's like January, February, March, 3-4 months. Okay, but it's been happening faster. But unfortunately, because of the coronavirus issue, I think we're going to see longer times for a little while until this thing gets solved. Okay, so let's now go into the actual, this last slide here, page 12, just deals with choosing an MLTC, 2 different types of plans. But again, you have a nice handout in your packet dealing with choosing the differences between the MLTCs. I'll just comment that what you really want is the first page ones, the purple ones. That's just like traditional old-fashioned Medicaid, meaning that the MLTC will only provide home care services. All your doctors and hospitals will stay the same. If you went over to an MAP plan or a PACE plan under Medicaid, then you have to switch. All of your doctors and hospitals have to be within that plan. Okay, but you can read about that in your materials. Okay. Okay, so now we will go right into a real Medicaid application. Okay, so if you will pull out, put away your slides, and you'll see the 2-part Medicaid application in your packet. And the first part of the application is called Access New York Healthcare. It's like a big blue cover with family pictures all over it and everything. And then also you should have ready your Access New York Supplement A, all right, which is a supplement, 6 pages. So the first thing I want to tell you about the application itself is that there are a lot of instructions. This is like, what is there? These 12 pages. There's 1, 2, 3, 4, 5, 6 pages of instructions, which a little bit of help, not that helpful because this application is very confusing. So why is this application confusing? The application is confusing because this one application is used for all kinds of Medicaid. And you need to know that there's many kinds of Medicaid. The kind of Medicaid that we're applying for today, or talking about applying for, deals with people over 65 who are elderly, blind, or disabled. All right. Now, you may not know that there's many kinds of other kinds of Medicaid. There's Obamacare Medicaid. There's Medicaid for prenatal babies. There's Medicaid for teenage pregnant women. There's CHIPS Health Plus for children. There's all kinds of Medicaid, all right, for all kinds of people of all different ages and health. And this one application is used for all of them. So what I'm telling you is that sometimes a lot of these questions may look bizarre for a 90-year-old or an 80-year-old person applying for home care services, but this application is a universal application. So there are a lot of things in here that do not apply, but just because they do not apply to your loved one, you still should answer it or show Medicaid that you're attempting to answer it, or that there's a reason why you're not answering. Because if you leave a blank, or don't answer a question like, are you pregnant? You go, no, mom's 90. I'm not checking this off. They're going to deal with this. If you send in the application and you didn't check off a box or didn't answer something, they're going to send it back to you and say you didn't answer, answer question 3, and then they're going to send it back to you, and you're going to have to answer that and mail it back in, and then they have another 45 working days to process the application. So, I will point out some of these little things that can be helpful. But okay, the second tip I want to point out when doing the application, and you should be turning to page 8 of the application. That's where it really starts. Okay, the rest is all instructions. So please turn all the way to page 8 of the Access New York Healthcare. Is that you should be prepared that for every answer you give on the application, you should give some kind of supporting documentation. Okay, so if you say this is mom's Social Security amount per month, you need a Social Security award letter showing that amount. You say this is dad's pension check from the teacher's pension or from the union, you need a pension award letter. You say my spouse is deceased, you need a death certificate. You say this is my rent, you need a rent receipt or something like that. Okay, so just get in that mindset. You don't ask for it, you should provide something to back it up. Okay. Some things, that's just the best principle to follow. Some things they can look up on their own in the computers, but don't trust that. They can just send it back to you. Okay, so starting on page 8 of the New York Access Care, the New York Healthcare Medicaid application. It's a kind of weird application format. It goes top to bottom and left to right a lot of times, all over the place. So let's just look at it. Okay, so first, applicant's information, simple stuff. Legal name, middle initial, last name, primary phone number. Now, other phone number. If the person, of course, is impaired and not remembering what's going on, Medicaid will usually not contact them. But if you want to have duplicates or have them call you at your house if you're the son or daughter or something, you will put down, the alternate address here and the phone number. There's no guarantee that they will regularly contact you. You can never tell. A lot of times I put an application in as the lawyer for the client and I don't get a notice, and the family gets a notice. Or sometimes I get the notice and the family doesn't get the notice. So it's hit or miss. But you should put down your contact information as alternate. Okay, now section B, that was section A, household information. All right. The first thing I want to point out here is that trips up a lot of people is that it says here, put down the names and answer all the questions for everyone in the household. All right. So that's a misperception in our situation. The only people who should appear on this application should be the applicant who's sick, okay, in box number 1, and then possibly in box number 2, if the person is currently married, legally married, you would then put the spouse's information in box number 2. Those are the only 2 people who belong on this application, because I've seen people who say, mom or dad live with us in our house, the children, and we have, a number of people in the house, children, grandchildren, whatever, and they start putting everyone's name on because they say put down everyone's name who's in the house. And that's not what that means, because if you put down anyone else's name on this application in spots numbers 3, 4, 5, 6, 7, you see on the next page, there's many spots here, because this, that each one of those persons would be applying for Medicaid, and they would want all the financial information for each one of those people. So no, they do not belong on here, okay? And because you see all these other slots on the next page, all the way through, there's like up to spots for 7 people on here, it tells you that this is for like, a young mother who is unemployed, who's got like 4 kids. They all belong in here because each one of them is entitled to health care under Medicaid, okay, if their income is correct. Okay, back to section B at the beginning. So you put the applicant's name, okay, then they have the date of birth, whether male or female. Is this applying for Medicaid? A person applying for Medicaid health care? Yes. Is this person pregnant? No. Person applying, a parent of an applying child? No. Okay, self. You see the first box there is Medicaid. Then they talk Social Security number. And then proof of citizenship. And now you see there's these little black boxes that say send proof. Definitely have to send proof for those things. I send proof for other things too, copy of social security card or whatever. So that's why this is unclear that they really do want those other pieces of proof, but there are certain ones that they just, I don't know why they've chosen to put black boxes on certain things. The last box is race or ethnicity. You need to choose an ethnic group. I've seen applications rejected if you don't, and everyone says, well, that's an optional choice, but well, yes, in theory it's optional, but workers mess up and reject your application if it's not filled in. So fill it in and choose an ethnic group. Okay, on page 2 of section B, there's all these spots for additional people. I would just put a big line through all of them and write NA so they know there's no other people applying. And then at the bottom of the page is anyone, it asks, is anyone in your household a veteran? Simple question, yes or no. I mean, it doesn't really help you either way. Okay. Section C, we're now on to page, boy, the print is so tiny on this version I have here. Page 10, okay. Section C is household income, right? So this is where we talked about in my slides about income. So here you're going to list all types of income: earned income from work, under-earned income, which would be Social Security, pension distributions, RMDs from whatever, contributions from family. Now, the purpose of Medicaid looking at income often is to, and also you see they're going to look at expenses, that they're going to be checking to see if you're reporting all your income and that you truly are being honest. Because if they see your expenses monthly exceed your monthly fixed income, they say something's not right, right? How can you be affording to pay for all these bills, fixed bills, with that low income? So most times it's family helping out, okay? And that's acceptable. And here, if family is contributing, son or daughter, whoever, are helping pay bills, they should put that down here. And then you need to supplement it with a letter explaining what you're doing. It just helps Medicaid say, okay, fine, the son is helping by paying the rent for $2,000 a month. So that's how mom's making it through the month. Okay. Then they ask about any other cash assistance payments from like SSI or whatever. The rest of the questions on this page are not tricky. Just answer them honestly. There's nothing here tricky, but make sure you do honestly answer them all, or put a little line through it saying not applicable. Okay, that's page 10. Now we move on to page, page 11. All right, okay. Page 11. Hard to go, it's little tiny small ones. Okay, we're in section D. Okay, health insurance. Okay, does anyone who's applying have Medicare? I'm sure the answer is yes. If so, give a photocopy of your Medicare card. Does you have any other kind of health insurance? And most people have like a Medigap policy. Okay, some people have long-term care policies. I mean, I would tell you the majority of people who have long-term care insurance to pay for home care and nursing home still apply for Medicaid. Because what happens is when the person becomes truly ill, the long-term care policy is not enough. So Medicaid will become the supplement to the long-term care policy. So we just have to show Medicaid that there is a long-term care policy and that is in payout and that you have to start using it. Housing expenses. You do need to show utility bills, okay, and rent receipts. And again, this goes back to the previous page when I mentioned about proof of anyone helping you out. They're justifying, they're looking to see total monthly expenses versus total income to see if it jives and make sure that there's nothing that just rings a bell that there might be hidden money somewhere that's coming in that you're not reporting. Okay, that was section E. Now we're to section F. Blind, disabled, chronically ill, or nursing home care. If no one applying is blind, disabled, chronically ill, or nursing home, stop. Well, we are chronically ill. That's the purpose why we're applying for Medicaid. So you don't stop here. You continue, okay? And you just answer the questions there. If you're in a nursing home, blah, blah, blah. Okay. Now on to section G. additional health questions. Okay, here, if you had any unpaid medical bills, because what would happen is you may discover that, mom has been eligible for Medicaid for the last 3 months. You just didn't know until you went to this class that she was eligible. And you have some unpaid hospital or doctor's bills or ambulance bills or whatever. You can put an application for Medicaid and request coverage up to 3 months retroactive prior to the date of application if you meet the resource testing. Okay, so that means you have to be below 15,000. And not you say, well, mom's been below 15,000 for the last 4 months, and now we're applying. We have some unpaid bills. Well, Medicaid will cover them. So you would attach the unpaid bills here and check off the appropriate boxes and so on, and they will, those vendors can submit the bills to Medicaid for coverage. Okay, questions about the spouse, are they living, deceased, whatever. Again, you'll need death certificate for a deceased spouse. I'm seeing more and more applications go in for couples who have been living apart for many years, but they just stayed married because they didn't either for religious reasons, they didn't want to get divorced, or there are certain other little reasons. And then of course, the one spouse steps back in to help with the Medicaid application or whatever, and then it gets a little complicated. But they do want to know all about a spouse because you have a legally support. Okay. Okay, now we're on to the last page, section I. And there's nothing really on this page except a signature. Now, signature, the easiest thing, of course, is for the applicant to just sign it and submit it. Okay. Now, if the person's unable to sign, a power of attorney may sign for them. Okay. However, if you're going to do that, you must attach a copy of the power of attorney. All right. So just make sure you do that when applying. So as it said early on, you do need to continue on to do supplement A. All right, so you put this aside, you have a nice pile with all your supporting documentation for the application. You put that aside and you pull out Access New York Supplement A. And it says there, this supplement must be completed if anyone who is applying is age 65 or older, blah, blah, blah. So that's us. Most people see that. Now, I'm seeing many, many clients coming around, unfortunately, who have early onset dementia, people in their early 60s, some people in their 50s. So that falls in the category of being disabled. If you cannot perform active gainful employment any longer due to your illness, then you fall in the disability category of any age. So you could be 40 years old, and if you're disabled, you are eligible to apply for Medicaid. Okay, so section A, simple legal last name, legal first name, no initial, social security number, marital status. Are you chronically ill? Yes. And then you can answer, that's the most important one, number one. Number two and 2 and 3, it's kind of repetitious, but it's whatever. Are you living, in the bottom of this page, are you living in an adult home or assisted living facility? Yes or no? I'm not 100% certain of the purpose of that question, but I want to know. Okay. Next page, page 2, resource and assets. So as you can, if you've been paying attention, the first part of the application dealt with basic biographical information and income. But now we're dealing with resources, because as I said, if you remember back to my slideshow, we did a whole thing on income. And now this is the part that discusses your resources, all right? So on this page in section D, the box you want to check off is the second box, which says you are applying for coverage of community-based long-term care services. You must submit documentation of the current amount of your resources. And these services include adult daycare, blah, blah, blah. So this is what we're really going for the home care for, okay? So as it says now below the big black box, you're going to be now listing your resources, okay, that are either owned by you and or your spouse. Okay, and see this last here says and parents, because you could have a child who has high medical bills, 9, 10-year-old child who has leukemia or something, and you could apply for Medicaid for them, and the parents' money is countable towards that child. And actually, what you would do is called parental refusal, just like spousal refusal. And actually, spousal refusal is an offshoot of parental refusal, where the parents who have some money that puts them over the Medicaid limit refuses to pay for the health care of the child. And therefore, the child is poor enough to go on Medicaid, and then Medicaid will investigate the parents to see what kind of money they really have. So it's a way of getting the insurance and dealing with the money issue later. Okay, getting the health care first and then dealing with the money issue later. So that's just an interesting point. So, okay, number one, checking, savings, credit union accounts, CDs, so on and so forth, anything of a banking nature. Okay, you put down the account number, who's the owner, and sometimes it's a joint account between a son and a father. But you should know that under Medicaid rules, joint bank accounts are presumed to belong 100% to the applicant. And the kid's name on there is just for convenience. So it's not a 50-50 split or anything like that. When you put the current dollar amount and the date, if it was closed, you put the date it was closed and so on. So that's that. Next section 2 is retirement accounts, IRAs. As I said before, while an asset may be exempt, like I said on my chart, that IRAs are exempt and not counted, Medicaid still needs to know about it because it could come up on this computer screen that Medicaid has money, and they need to say, oh, that money in that account, under that account number, is an IRA. That's therefore it's exempt. But if you haven't told them about it, it could just show up on their radar and they could deny you until you explain. So as you say here, you put the account number, who's the owner, what kind of institution it is, how much money's there, and then it must be in payout. All right. So all the boxes here have to be yes. Okay. You have to unfortunately contact the IRA, request that it could put monthly payout based on the person's life expectancy. Then you need a letter from that financial institution stating that it is a monthly payout and this is the dollar amount. Okay, so all these things take time to get. That's why it takes time to prepare a good application. Next page, section 3, life insurance policies. Life insurance policies have to be explained to Medicaid because if there's a cash value, okay, as you should know, may not know, there's two types of life insurance. There's term and there's whole life, okay? Term life insurance means that there's just a payout when someone dies. There's no other value to it. When the person dies, a check goes to the beneficiary, end of story. Whole life, though, is a life insurance that has an accumulating savings component that has money put aside that you can borrow, okay, which actually gets subtracted from the death benefit later. But you can borrow against, you always see this, the movies, they always borrow against life insurance. So if there's cash value to a policy, you do have to disclose that to Medicaid. And that is money. And if it puts you over the limit, you're going to have to move the money out of that policy or do something with it. Okay, so you see this cash value and this face value. The face value is what's paid out of death. Cash value is what you can borrow while you're alive. Most times we tell people what you have to do is just change the ownership of the policy. So, mom and dad's life insurance policy can be owned. You just switch the ownership over to the son, who's also the beneficiary. So now the life insurance still stays on dad's life, but the owner of the cash in the account of the insurance policy now belongs to the son. So there's just technical things that you would be advised to do by an eligible attorney if you sat down with them. Section 4 deals with annuities, stocks, bonds, mutual funds. Again, just put down the values and the dates and so on, and you have attached copies of all these statements. Trust accounts, okay. If you have any kind of trust of any nature, you must put it here if you're the recipient or you're the creator. And you need to send a copy of the trust into Medicaid. And you should know that that trust will be reviewed by the legal department at Medicaid to make sure, is it countable money or not. And, you should be prepared that if you do have a trust, to submit it to Medicaid. It will add a few weeks, if not a month or two, onto the application processing time, because it just takes time to review those things. And, I would strongly advise before You do that. If there is a trust, you should have elder law attorney review it ahead of time, just to avoid any problems, to make sure that it was a properly drafted trust for Medicaid purposes. Section 6 deals with burial accounts, burial contracts. As we said at the beginning, prepaid funerals are fully allowed for the entire family or anybody. You must, though, have a special, irrevocable, non-refundable burial account set up with the funeral director. And you must tell the funeral director that you're going on Medicaid, because there is a special form they use that is the pink form, and you have to submit to Medicaid to prove that it's non-refundable, paid into the funeral home. All right. Okay, bottom of the page deals with vehicles. You're allowed a car, so most people have one car. I just did an application for husband and wife, and the husband has like 5 cars. He's doing spousal refusal, so he just likes cars. So I don't. Okay, next page, page 8. Equity value in the home. As you will recall on the previous slideshow, there is a maximum value of $890-something thousand of your home. So you do need to put down home value, and it's more or less a self-proving thing. I mean, there's a form we do submit to Medicaid, says what your estimated value of the house is. Medicaid has a right to go double check it, but we've just been using that. So it's, people get a little crazy about this, but it's not the market. I mean, sometimes people say, oh, the market value is $1.2 million, but I said, well, how do you know what's really going to sell at until you actually sell it? So we usually can get, some real estate brokers saying, rock bottom valuation. There's a space here for other resources. I mean, if you have, and in other property, like section E here, if you have a vacation home, you have timeshare, vacation home in the Hamptons, a little house cabin upstate New York, that is real estate, and that's not your homestead. That is not exempt. So they want a valuation on that, and that will be money. And many times we have to transfer these little properties over to children, or sell them, or move them to the spouse's name, so they can then do spousal refusal. So, you have to think these things through about what you really own out there, including timeshare, which is ridiculous. And as you know, it's very hard to get rid of a timeshare. Okay, homestead questions. They just ask about your interest in the house, because sometimes you only own a partial interest, or what's called a life estate interest, meaning a lifetime lease to live in the house, and so on. Some other questions about the house. And then you hit the black box at the bottom. The black box at the bottom just says, if you're applying for nursing home care for this applicant, then you need to continue onward. But if you're not, which we're not, we're doing only home care today, that here you would stop. This would be the completed application. Now, if you turn the page, just take a quick look. If you were applying for a nursing home, here they ask you about, have you made any transfers over the last 5 years? And then they would be, tallying up those transfers and imposing a waiting period on you for nursing home care. But again, we're not doing that, so you stop here. And you should know that when you finish this supplement A, once you total up all the valuations in this section, the total value of your net worth of the person applying should be less than the $15,000. Okay, if you tally this up and you say, well, I'm at $20,000, you're going to be rejected. There's no question. So therefore, go back, rework your numbers, and then redo the application. Okay, that's why it's important to know the eligibility rules, right? So now you've completed in your forms the actual application supplement A. You take that, you put that together with all the supporting documentation, okay? The birth certificate, the picture of your passport, your driver's license, divorce decrees, pension award letter, Social Security award letter, Medicare card, all that stuff. You never send originals. You only make photocopies, okay? It's just, you'll never get them back if you send it in, all right? You then put all the supporting documentation behind the application. You put a cover letter on the front. You say, applying for Medicaid home care. Maybe make a nice little list in there, what you're submitting, okay? And then you either mail it in, all right? Or you can drop it off at a Medicaid office, and you should always get a receipt. If you're mailing it in, you do it FedEx or you do it with the old-fashioned certified mail thing, and you should always get proof because it's not unheard of for Medicaid to totally lose the whole application. Okay, you send it in, you sit around and wait 45 working days, you don't hear anything, and finally you try calling in, because you can only call in after 45 days, and you start asking about the application. They go, "You have no application in the system under that social security number or anything." And you say, "Well, I have proof. I sent it in 45 days ago." They go, "Oh, okay, send it in again with proof that you sent it in, and we'll process it again." And so at least if you have the proof that you sent it in, they will retroactively cover you, because they screwed up then, for the period 45 days have gone by. If you had to pay for home care and they messed up, you can submit those bills for reimbursement. Not that it's easy, but at least you have that proof. Okay, you don't have to start from scratch. Okay. Like I said, you should be prepared that even though even I, who do what I consider a almost perfect application, hopefully, when we send it in, we get deferrals. What's a deferral? You get a letter back in a couple of weeks saying, where is the birth certificate? Or where is this form? Or where is the death certificate of the spouse? And we know we submitted it, okay? But they lost it or misplaced it, or didn't see it. And they're going to send you this letter, and they're going to say, we need this information that's missing. And they'll give you 2 weeks from the day you receive the letter, not the day they mail it. That's unbelievable. And then you have to get the reply into them within the time frame they've given you. Otherwise, they will just outright deny the application. Okay. During this coronavirus thing, they are being more lenient and a little more flexible about the whole thing. I've been told, and hopefully this doesn't last too long. But just be ready that unless in my office, we don't even argue with them. We just fax it over to them or mail it to them right away or call in. You can get an extension of 2 weeks, but it's not a thing that you go into a lot of the clients get upset and they run and do a fair hearing over this and try to ask for some kind of, that's not my fault or something. So it's a crazy process, and you should know that unfortunately processing agents down in Medicaid, their job is to try to find mistakes in the application to try to deny your application, because it saves state money to delay an application and get it processed slower or denied. That it keeps you off the program and has them spending less money on care. That's just a reality of the situation. So I hope this was helpful, and you'll decide whether you want to tackle this on your own and try it out, or you're welcome to find someone to help you do a Medicaid application, and just keep at it, and be ready for a bumpy road, because it's like, people ask me, do you have to have an attorney do it? No, you do not. Okay, you can do it on your own. It's a public entitlement, but a lot of people just don't have time to figure out all these little things and package it correctly, and then deal with the Medicaid runaround when they send you something wrong. I mean, we've sent in reply information to Medicaid in answer to their questions, and then they turn around and they deny it, and we find out what the reason for the denial is, and it says you didn't supply the information we requested, and then we have to say to them, yes, we did, we have proof we did, and they go, oh, well, then show us the proof that you did. And it just delays the whole process months. But that's just the part for the course. You have to deal with it. So thank you for listening, and I hope to see you in live classes once we return to the real world and get out of our homes. Okay, so thanks, and stay safe.